Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be going over Sjogren's syndrome. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it, so go ahead and press that like button now so you don't forget. Subscribe to my channel if you haven't done so already, and don't forget, I'm now offering Next Generation NCLEX review sessions, part 1 and part 2. One-on-one tutoring, one-on-one consultation sessions. You can reserve your spot right now by going to my website, nexusnursinginstitute.com. While you're there, be sure to check out the audio lessons that I have available. Also, don't forget, almost daily, you can find me covering a variety of nursing topics across my other social media platforms, such as TikTok, Instagram, and Facebook. My handle is the same everywhere, Nexus Nursing. So go ahead and check it out. All right, guys, let's take a look. Sjogren's syndrome. Now look at the pathophysiology. The first thing it says, Sjogren's syndrome is a group of problems that often appear with other autoimmune disorders. So stop right there. When you're studying and you're reading, do not read just to read. Read to understand. So let's look at that first sentence of what it's saying. It's saying that Sjogren's syndrome, is a group of problems that appear with other autoimmune disorders. Number one, whenever you see a title and it says syndrome, let me explain to you what syndrome means. Syndrome means a cluster or a group of symptoms that we see with a particular disease or disorder, all right? So Sjogren's syndrome is not a disease itself, it's a cluster of symptoms that we see that is associated with other diseases. And if you keep going in that same sentence, it says that often appears with other autoimmune disorders. This one sentence has told us a lot. So number one, we're dealing with a cluster of symptoms and it's associated with autoimmune disorders. You guys need to know those important autoimmune disorders in nursing. Let me lift this up. I wrote a couple of them down for you, but there are more. You need to know them. Autoimmune disorders such as lupus, rheumatoid arthritis, rheumatic fever, right? Autoimmune disorders, these are disorders where the patient's body is basically attacking itself. It's the own patient's body that's causing the issue. And so these patients are already at risk for infection. Their immune system is down because their own body is attacking them. So Sjogren's syndrome is a cluster of symptoms we see associated with other autoimmune disorders such as lupus, rheumatoid arthritis, etc. Let's keep going. It says problems include, here are clinical manifestations: dry eyes. Let's stop right there. If you've been following me for any amount of time, right, I've talked about this. Patients got dry eyes. The reason that you blink is so that your eyes can be lubricated. The lacrimal glands go ahead and release that lubrication. You have dry eyes. That can cause corneal ulceration, right? So that can decrease the patient's vision. Let's keep going. Dry mucous membranes of the nose and mouth. That's also known as xerostomia. By the way, xerostomia is the dry eyes and the dry mucous membranes in mouth. Vaginal dryness. These problems are caused by autoimmune destruction. Again, guys, the patient's body is attacking itself, their own immune system, okay? So it says these problems are caused by autoimmune destruction of the lacrimal, salivary, and vaginal mucus producing glands. And that makes sense. It makes sense. That would cause the patient to have the dry eyes, to have the dry mouth or dry nose, or even the dry vaginal area. Let's take a look at who's most at risk. Look at what it says here. Most patients with Sjogren's syndrome are women. Okay, so women are at highest risk between 35 to 45 years of age. Insufficient tears cause inflammation and ulceration of the cornea. This patient is at risk for vision issues. Insufficient saliva decreases digestion of carbs because remember, guys, you have enzymes in your saliva that actually breaks down the food, right? So take a look. Insufficient saliva decreases digestion of carbohydrates, promotes tooth decay, and increases the risk for oral and nasal infections. Vaginal dryness increases the risk for infection, and it causes painful sexual intercourse. Collaborative care. Let me see if I can make this any higher for you guys. I'm sorry about that. All right. Collaborative care. It says the patient with Sjogren's syndrome usually has blurred vision, burning and itching of the eyes, and thick mattering on the conjunctiva. Difficulty swallowing, because remember, they have decreased saliva as well. Difficulty swallowing food is common, so it's going to change the patient's taste. You have to ask the patient about epistaxis, nosebleeds, and frequent upper respiratory infections. Let's stop right there. Think about it. The dryness is not only in the eyes, it's in their nose and mouth. Why are we concerned about dryness in the nose? So for example, you know how if patients are on oxygen, especially for any extended amount of time, we always want to lubricate the nares. We always want to have moisture in the air. Why? We always want to give humidified oxygen. Why is that? Because when the nose is dry, what's going to happen to those mucous membranes? What's going to happen in that area? It starts to crack. And that's a perfect environment for pathogens, for bacteria to get into the patient's system. So it's very important that the nasal area stays nice and moist. We don't want it to be dry because it's going to be cracked and increase the patient's risk for infection. Okay, so all of this makes sense. Let's keep going. Examination reveals enlarged lymph nodes, and that makes sense that the patient is going to have enlarged lymph nodes. We know this is an autoimmune disorder. We know the patient's going to have problems with immunity. We know this patient's going to be at risk for infection. Let's keep going. There's no cure. My apologies. I had a little bit of technical difficulty, but I'm back. All right. So there is no cure for Sjogren's syndrome. The patient is treated by their symptoms. Okay. So let's keep going. Drugs are used to modulate the immune system in the patient with this syndrome. They're going to get low-dose chemotherapy with methotrexate, or they can get Cytoxan. Both drugs have serious long-term effects, and that makes sense because, guys, these are chemotherapeutic agents, okay? So they're going to have toxic effects, especially on the liver and bone marrow. Why is that important to us? Well, you got to remember why the liver is important, why the bone marrow is important. Remember, the liver is important for metabolizing medications. The liver is important for our clotting factors, right? The bone marrow is important because that's where our blood cells are made, your red blood cells, your white blood cells, your platelets. Let's keep going. Other medications, corticosteroids. Remember, corticosteroids are important for decreasing inflammation. Cyclosporine, hydroxychloroquine. You can teach the patient about the use of artificial tears because of the eye dryness. Artificial saliva, that's going to help them when they're chewing the food and to be able to swallow much easier, and to help with the taste for the food. You can teach the patients to use humidifiers in the home to increase the environmental moisture. Remember, we do not want those nares to get dry and cracked. That is a perfect medium for bacteria to come in. You're going to teach a patient about vaginal lubricants because of the vaginal dryness. You're going to teach them about moisturizers. Let's keep going. It says some patients relieve dry mouth with drugs that increase salivation, such as pilocarpine. I've talked about this med before when we went over the vision issues. Make sure you go back and read up about pilocarpine. A drug that can increase tear production is cyclosporine. That's the Restasis eye drops. And guys, that is your Sjogren's syndrome in a nutshell. You guys really focus on this syndrome mostly when it comes to lupus, but we do see Sjogren's syndromes in lots of other autoimmune disorders. So I just wanted to make sure that you guys understood this syndrome. Again, it's not a disorder, it's not a disease within itself, but it's a cluster of clinical manifestations of symptoms that we see associated with other autoimmune disorders. And guys, that is your Sjogren's syndrome in a nutshell. Very quick video, but to the point, meat and potatoes. So please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover next. Let me know what you'd like to see me cover more extensively. I'm sorry about the technical issues. Remember guys, my camera broke down. I had to get a new one. This one's new, but it's acting up. Who knows what's going on? Thank you for watching this video, guys, and you guys will catch me on the next video.